San Francisco is exploring a controversial method to get homeless alcoholics off the streets and into housing. The plan would house them with taxpayer dollars and allow them to continue drinking. It's an idea that's generating a lot of talk. ABC 7's Carolyn Tyler is in the newsroom with more on this plan. Carolyn?
Well, it's modeled after a program in Seattle where 75 units of housing opened 5 years ago. San Francisco streets are home to dozens of chronic alcoholics who are clogging the emergency medical system and the city's jails. For example, Paul Sanchez, a self-described drunk we met a few years ago, had been arrested 128 times and hospitalized 50. Supervisor Bevan Dufty thinks there might be a better approach, so-called wet housing, modeled after this project in Seattle, where homeless alcoholics are allowed to live and keep on drinking.
Providing a medically supervised, safe living environment in which people who are chronic inebriates, who are probably not going to change in their lifetimes, have the ability to live safely, but also don't draw on the public resources.
A 3-year study by San Francisco's health department found 225 of the worst offenders accounted for more than 1,900 EMS pickups and spent more than 2,000 days at SF General Hospital. In all, their treatment cost taxpayers $13.5 million a year.
It is not a good idea. It's bizarre.
Dr. Eugene Schoenfeld has worked in the field of addiction medicine for more than 40 years.
The best solution would be to have them hospitalized involuntarily if necessary and detoxified.
He believes the wet house allows severe alcoholics to keep killing themselves. On the face of it, it seems
enabling.
Yes.
Yeah, it is. But so is methadone maintenance.
Mayor Gavin Newsom supports Seattle's concept.
And at least this gets people through the door, and then you can start saying, hey, we're here for you. Right now you have people that aren't going through any doors, that are all out in the streets and sidewalks, and they're hard to pull in. This may actually help save some lives, reduce costs to taxpayers.
Seattle officials say their program saved $4 million the first year alone, and a study by the Journal of the American Medical Association verified some cost savings as well as a drop in alcohol consumption by the homeless. Supervisor Dufty heads there for a look next week. In the newsroom, Carolyn Tyler, ABC 7 News.
All right, thank you, Carolyn.